Hi everyone.
Hi everyone, good evening.
Welcome back to another Facebook update, Facebook Live for the coronavirus. This is our number 3 coronavirus Facebook Live.
And we're here today again to answer your questions. And first, let's start with some updates. So do you
Yeah.
do you want to take that?
We are on day number 20 of the lockdown. The lockdown started on the 25th of March. So that's when we really went on lockdown, and today is day number 20. And since that has started, we've had almost 1.8 million cases in the world as we speak today. That's almost 18 lakh cases across the world. There have been about 115,000 deaths with the coronavirus COVID-19. And in India, we are at 9,000 odd cases with about 300 deaths or so. So if you see actually, from where we were before the lockdown and where we are today, we've done a pretty good job, I would say, of containing it. When the lockdown started, we were on 530 cases, and today we are at 9,000. I know it sounds a lot. That in 20 days we've multiplied almost 20 times. But that is, if you think about it, if we were not on lockdown, this number would have been astronomically higher. This would have been a much, much higher number.
Absolutely.
So I think we're doing a good job in the lockdown. We've been able to contain it well.
And I think having containment zones, yes, it's a hassle for people who are stuck, but at the same time, I think these are the best efforts that are being put in by the government at this time. So it's, these are the rights, we're on the right steps. And the other, I think, good step that the government is taking is making masks now compulsory going out. And a lot of the states are coming up with it. Delhi's already made it, UP's already made it, Haryana, Gujarat. So everywhere now they're recommending when people go out in the public, you should wear, masks. And the masks can be very easily made. Just simple cotton masks. Even they have good data. Almost they can help you by almost 70%. And that's a very, 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 very good percentage. But the important part for everyone still is when you go out and when you wear masks, keep that social distancing still intact. Keep that 3 feet to 6 feet of a distance, between whoever you're standing with. That doesn't mean just because you're wearing masks that you should be sticking close together. No, you still have to maintain that distance. So I think that is extremely important.
I think Sumit Ringwala, I know he's actually a friend, and he's an interventional cardiologist in the US, and he's shared a link from the annals of internal medicine about the effectiveness of surgical cotton mask. The Indian government has actually made it mandatory in many states to wear masks when you go out in public places. In Delhi, I know where we live, it's become mandatory.
Yeah.
In Uttar Pradesh, it's mandatory. In many other states, it has become mandatory. So I would encourage people to wear masks. It's not just for you; it's also for the person in front. And also, if you may be infected and you don't really know, then you prevent the spread of infection. Some other updates regarding what we've gone through over the last this thing. Now if you look at the Indian death rate, right? The Indian death rate is about 331 people have died. So 2/3 of these people are more than 60 years of age. Okay, 2/3 of the people are more than 60 years of age, and 1/3 of the people are between 40 to 60 years of age. And then 7% less than 40. So it's important for everyone over there to understand that even though you may be young, you're not invincible. You can succumb to coronavirus. You can succumb to COVID-19. And then more importantly, not just you may also transmit it to your family members with whom you may be staying.
And actually that's another reason why maybe masks are important, because more than 50% they've seen might be asymptomatic, or they have very mild symptoms. So in that case, if you're asymptomatic, you may not even realize it. You might have an asymptomatic condition, but when you pass on the virus to the person next to you, that person might end up having symptoms which might be very severe. So for that very reason also, I think it's very important that masks at this point are worn. And on that note, I think we're getting
a lot of questions, but somebody asked us, Ashita over here has asked us, tell us more about your platform of Voice of Health. So, so Voice of Health is a platform we started about 3 years ago. Yeah. And this is a platform which we believe in. It's a platform for health awareness. Everything we speak is factual. It is based by credible scientific evidence. And and this is where we come, and you can come on this platform, you can like the page, you can subscribe, like.
Yeah, absolutely. Facebook, Instagram, Twitter, and our main goal is to help spread awareness. And I think when we we trained in the US, and when we came back to India, we said, what, how can we at least give back in some way? And I think this is one opportunity we get, where we get to interact with people, directly on, and through Facebook Lives. I think that opportunity is there even more.
Yeah.
So I hope everybody is still, maintaining their social distancing. They're washing their hands regularly. They're keeping their 3 feet of distance and avoiding going out as much as possible. Tomorrow is going to be Modi's speech.
Yes, tomorrow 10 o'clock,
Yes.
Our Prime Minister Modi is going to speak. We don't know what he's going to say, but from what we hear right now, as we speak, they have improved. They've allowed some traffic, some factories to be open with social distancing. Very, very, very important. And I guess we'll learn more tomorrow.
Absolutely.
One of our viewers, I think Aditi Garg is tuned in. She actually emailed us and asked us a very interesting question. She asked us that in people, so right now schools are closed, colleges are closed, and children are home, everybody is homebound, and they've started these online classes, right? So what do you do for screen time in this? How do you do screen time for children who are homebound and who are watching, and who are getting tuitions and everything else online?
Right, and I think the important part, I think the concern was that now suddenly the screen time has gone up. So how does that actually even harm the child? Can it harm the child? Like now, there was a point when you would not want your child to look at the computer screen. There was a point you would not want your child to look at the phone screen. And now suddenly they're on the screen at all times. In fact, somebody at work was telling me that there's such a big deal now with screens that between family members there's almost like a fight, because everybody has Zoom conferences. The children have their classes, somebody's working from home, and they don't have enough screens to actually do the work.
This is the real world. So, coming back to that, to children and screen time. Now, children, now the recommendations by the American Association of Pediatrics and other scientific associations is that if you are less than 18 months of age or 2 years of age, you should have no screen time. Zero screen time. And the reason for that is that the children, they learn more by seeing at that age, right? By seeing, by actually visually, by making them do things, and then they doing things themselves, and then watching you do things. That's how the mind of the child works. After 2 years of age, the child can get about an hour of screen time a day, max an hour and a half. And then as you grow older, the screen time can increase. But it's important to remember that too much screen time is actually not good either, because you can have back pain, neck pain, eye problems, etc. So one of the things you do, when you're getting classes, right? If your child is 7-8 years old and he's now being homeschooled and he's got an online classes, then that time that screen time can actually be discounted. And the reason is it's interactive, right? It's not just one way where you're watching like a cartoon or you're watching a movie with a screen. So that is important to remember, that that the teaching that the child is getting, right, by screen time with online classes is actually discounted. But it is important that after the class is done, you engage the child in other activities, right? I know you're homebound, but maybe play a board game, play with him, do things with him, and keep him mentally engaged and away from the screen.
And I think definitely work on their posture as well, because that's one place where, a lot of them, especially with the neck, as Samir mentioned. So posture would be one thing. You will have to train your child from now on, when they are young, how to sit properly. We all have a tendency to slouch, so it's very important to, work on that and work on the back muscles in advance. Yeah, we are slouching. That's the reason I realized. Yeah. That's the reason.
So we have a lot of questions coming up. I have the questions right here in front of me.
Okay, great.
Let's start with the first one. Akash Saglani, what precautions do you need to take while traveling?
Once restrictions are lifted.
So,
again, you would want to maintain you still have to maintain social distancing, so it's going to be a very difficult decision, China is seeing a second surge
Yeah.
of cases, and that's definitely a concern. Yes, 80% of their cases are from travelers who came back home, but again, that's a concern that is coming up. So definitely, we still have to maintain social distancing. I'm sure the government is going to come out with rules with that as well, that when people go back to work,
Yeah.
you have to wear the mask. I think that's going to be a no-brainer. And definitely avoid traveling in crowded places. I think I'm not sure how many systems of public transport they would start or what rules they would follow, but at least try your best to maintain that 3 feet of distance. I know it's easier said than done, but these are the precautions you have to do. And of course, keep a hand sanitizer with you wherever you can. Wash your hand with soap and water. That's the simplest way. Otherwise, keep a hand sanitizer with you whenever you touch surfaces when you're traveling. Even if it's in a car and you're touching the car seat or any surface at all, or maybe by the metro if you're traveling, just make sure you do not touch your face and you wash your hands regularly.
I think this is a good time to tell them about the app.
Yeah.
Yeah, so the government of India has done a fantastic job. Kudos to every effort that they're doing, and they've come out with this very cool app called the Arogya Setu app. It's actually been even the WHO has actually commended India about this app. Do you want to tell them about this app?
Yeah, so this app, I would actually recommend everybody should download the app, and it does 2 things for you. First thing, it actually screens you to see are you somebody who's susceptible to COVID-19 infection. Number 2, and if you are, where do you go for testing? Number 2, it also looks at your location, which scary as it might sound to some people, but it actually looks at your location and lets you know in case you are in an area where people who are positive are coming forward, or somebody you might have been in touch with. So I think it's a good app to keep, and it's very informative. It's very well made. Actually, it's very impressive what the government has actually done.
It's actually very cool. They track that if you've ever crossed paths with somebody who's had COVID, and that's pretty cool. So we've downloaded it. I would recommend all of you over there also consider downloading it.
Yeah, I think we should now go to our questions.
Yeah. Somebody had asked. I think Samrat had asked from Afghanistan that they're saying that the young people don't die with the coronavirus, and that's absolutely not true.
Yeah.
Please do not believe that. Coronavirus can affect everyone. Even like I said, in India, less than about 7% of the deaths were in people less than 40 years of age. So it can affect everyone. Please be careful, and you can also infect your parents or your grandparents or your uncles and aunts or your neighbors. So please disregard that. It can affect everyone and anyone.
And I would want to add in this that in younger people, so there are younger people dying, and even in the US, we have cases where younger people are dying, very healthy people are dying, and nobody's sure why this is happening. So this is something that people are still trying to understand about the COVID-19 infection. Could it be related with some genetic part of it? Could it be related with how your lungs respond? Could it be related with the viral load? Another theory that is coming out is young people feel that, we're young, we won't get it, and if we get it, it might be just a mild infection. So, why take precautions? But you have to take precautions because another theory that is coming up now is the amount of viral load you are exposed to.
Yeah.
So it could be that, somebody's exposed one time, and then there's somebody who's being exposed repeatedly and repeatedly. So they might end up having a more severe infection, and I think that's
why healthcare workers are actually getting infected at a high proportion.
Yeah.
And they're getting very sick also.
Yeah.
I think that, from what I was reading, I think there have been like 100 healthcare providers in Italy who've died.
Yeah.
100 healthcare workers, that's a lot.
That's a lot. And
that's huge.
And it could be related maybe with the repeated exposures that they are having. Should we take the
So Payal asked us a question: is it unsafe to have dogs, homeless or otherwise, as pets at home right now? Would I be at a risk of getting infected, especially homeless dogs?
No. So yes, there was one rare case here or there where maybe a pet might have been infected, but no, you're safe from your pets. Please live with your pets, give them all the love, enjoy the time with them. And even with homeless animals are not really found to have infection from the COVID-19 virus. A case here or there, they have suspected maybe one random case came out where they were suspecting it, but no, not at all. So do not be scared of animals, and do not be scared. I think you have nothing to fear from that point of view.
And play with your pet. It's locked down. Go play with your pet.
Exactly.
And your pet is probably safe because he's probably homebound, and he's not going to contract coronavirus from anybody else because he's home all the time. So yeah, I wouldn't worry too much about
And
it.
again, just remember washing your hands. It
Yeah.
just comes down to this basic, prevention. I know we're repeating this again and again, but we can't stress on it enough that how important hand washing is, just in general and especially in this condition, for sure.
I think there was another question which Meher asked us, Meher
Yeah.
Gupta.
Yeah.
What do you think of the current coronavirus outbreak in India in comparison to global numbers, keeping in mind our population? So I think that all the entire thing boils down to. The entire thing boils down to that we've done a good job of containing it. So we have to contain the virus. It's very important to do that. And I think lockdown plays a very important part of that, because if you see in countries which did not have the lockdown, the numbers just escalated, and in India they're at a slower pace, they're going up. So I think we've done a very good job compared to a population of containing it.
Oh, absolutely. I think 1.3 billion people. So yes, we are having cases. Yes, the cases are going up, but yes, our testing is not at the level it should be. But that being said, we have so far in India tested 2 lakh people. So let's say 2 lakh people have tested, 9,000 or so have tested positive, and out of that, a lot of them came actually from the hotspots too. There's a fair percentage of at least 1,000 people coming from hotspots as well. So I think overall, India is doing a decent job. Yes.
Good job.
And I think with the circumstances, it's not easy. Different population, different parts of the country.
And I saw this
Yeah.
video where people were not following social distancing
Yeah.
at all in some parts of the country, and that I found very very scary. It was actually very sad.
It was actually very sad.
It was very sad to see that. There is a question by Umkal Hospital called, and which is about what about takeout food? I think it's been asked by Mrs. Kalpana Gupta. What about takeout food? I think takeout food is very important. The same thing goes with groceries too, right? When you get anything out from outside, you take it, you get inside the house. Whatever container the food came in, wipe it nicely with soap and water or with sanitizer, and then you can take the food out and then eat it. And I actually go an extra mile. I think I normally try and heat the food also.
Oh, absolutely. Recently we spoke to actually one of our cousins in the US, and she's in the front line over there, and we were discussing about takeout food. That do you clean your takeout food? What do you do? And she said, you know what? I'm in the front line. I do not want to get sick from takeout food. I mean, the last thing would be that. So I take all my precautions. I clean my food. I heat my food. So I think one tip definitely is maybe avoid cold food from outside right now. Avoid takeout food that is cold. Get warm food, and then when it comes home, warm it again, just to ensure that the virus, again, chances of being infected from the fecal-oral route or from this are not very high. There is no proof it's a droplet infection, but these are the simple precautions that you can take. Yeah.
There's another question by Arpit Rohila. Any tips to fight boredom? So that I think suddenly all our family WhatsApp groups बहुत ज़्यादा active हो गए हैं. सब लोग 24 घंटे jokes भेजते रहते हैं, quiz होते रहते हैं. I think everybody, what I would say is, you're not going to get this time again, right? So use this time to stay healthy, eat properly, exercise, and most of all, try and gain a new skill set, right? I mean, we guys are working every day. We're going to the hospital, seeing patients. I'm operating, she's doing everything else also. So, we guys are fairly busy, and, we have to go to the hospital. But for you guys, I would say, utilize this time and try and get a new skill set.
And this time that won't come back.
It's not going to come back.
And
spend time with the family.
When the lockdown is lifted, which everybody is desperately waiting for, it will actually take people some time to get used to the fact that, okay, let's wake up early, let's go to work, let's get stuck in traffic again. So, and that time people will start complaining that, अरे यार traffic शुरू हो गया, फिर से ये काम हो गया, अब जाना पड़ रहा है काम पे. So enjoy the time that you have, and it's valuable. You have the luxury of having this free time. So I would say enjoy it. We can vouch for the fact that this time is luxury, because I think at least currently the essential workers are not getting that. So be it be media, be it be healthcare workers, be it be everybody, even the government. Whoever is working.
The government is going to start going to work tomorrow.
Yeah. They're going to start going to work tomorrow as well. So yeah, definitely.
And with the lockdown, the streets are empty. It takes us 1/3 of the time to go to our workplaces. 1/3. I'm loving it.
No, absolutely. And the best part is our pollution is under control as well. And I think allergies are better in people. I think overall people are just loving it. They're seeing the stars for the first time. So, get that opportunity, breathe in the fresh air, and just enjoy your time. I think don't avoid getting bored.
So Akash asked us, can you tell us more about the vaccine trials that are going on right now? Akash, one thing which is very impressive about the COVID-19, the novel coronavirus fight, is that all the scientific minds in the world across platforms are working to find solutions for COVID. They're working to create amenities to treat COVID, like the N95 masks, the ventilators, the PPEs. The entire scientific minds of the world are right now there. It will take us, I think, about a year, 12 to 18 months before we have a vaccine which is going to come, and there are multiple people are trying multiple things. And the reason for that is that first you try and figure out what you're going to make the vaccine with. Then you inject the vaccine in test people, and you see what is the immunogenicity, how much antibodies can you form with the vaccine, and then it goes into phase 3 trials and then it comes out into this thing. So it's a long process. It's just not that, oh, we identified it, I'm going to give it to you tomorrow.
Right.
Because then, potentially this vaccine is going to be given to a few billion people across the world.
Absolutely.
Right?
Absolutely.
So you have to make sure it is safe and effective. You don't want to get a false sense of belief either.
Exactly. And the good part is that we are seeing that antibodies, so another, I think one step towards treatment is that now in the US, and they're going to start this in Kerala as well, they're taking plasma from patients, from people who got the infection and now they're fine, and they're taking that, so that's full of antibodies, rich antibodies that these cells that fought with the virus, and now they're strong enough to fight the virus. So they're taking these antibodies and they're injecting it into sick patients, hoping that these antibodies will then go into that other person and fight it.
So let's explain to them what are antibodies.
So
you get infected, right? So you get infected with, for example, this pen. Let's assume this pen is a virus, and you get infected with this, right? And I get the infection. I'm jinxing myself, but I get this infection, right? So my body is going to create my body is going to create soldier cells against this. Okay, so these soldier cells are now going to be formed in my body, which have fought this virus, and this virus is the pen, right? Then I become okay, and somebody else gets infected. So now they take my blood, they identify these soldier cells. These soldier cells are then put into that person, and it goes and attacks the virus. The benefit is your body will take about 7 to 10 days, sometimes even 12 days, to create antibodies against this virus. But if you are very sick and you don't have time, then the antibodies you took from me are going to go and fight that virus, and it's going to make you better. But this is still under clinical investigation. They're trying this in multiple centers across the world. And they've tried a few cases in India. We've got some benefit. Some places they haven't got that much benefit as they expected. So I think it's going to be a wait and watch game.
It's going to be a wait and watch game. But definitely, that being said, I think there's hope. And again, this is a very different, even though this is a viral illness, I think this is still something we're trying to understand. And it's not like a usual viral infection, and I think that's what's coming. So I think day by day, literally every single day, new data is coming out, new information is coming out. People are studying patients who are sick. They're trying to understand what is happening. They're trying to understand why are people who are immunocompromised getting sick. They're trying to understand why healthy people are getting sick. So I think as the days go, we will definitely get a lot more information. And and we'll continue to update you about that, as and when we keep on getting this information. Yeah.
So like our page, subscribe to our page, Instagram, Facebook. We have a website, voiceofhealth.in, where we keep a lot of information, health information, not just the coronavirus. Feel free to reach out to us. Our email is there on the website too. You can message us. You can post new questions.
Absolutely, and not just regarding the coronavirus. I think if you have questions regarding any issue that any health issues, or if you have a question in general, just feel free to email us, ping us, send us a message on Facebook, and we'll be more than happy to get back to you and answer to whatever way we can help you. Right?
So very nice to meet you guys. Very nice to talk to you guys. And download the Arogya Setu app. It's good. Practice social distancing, hand hygiene.
Most important, hand hygiene again, and I'll take 20 seconds to tell people how to wash it. So if you had a sanitizer, I'm just going to use the sanitizer for now. So I'm taking 2 pumps of it. Again, palms, dorsums, in between your fingers, in between your nails, thumbs, and in the middle of the palm, and then your wrists. 20 seconds in total, and your hands will be clean. So please, please, please practice this before you eat, before you touch your face, after you touch any surface. And I'm sure with all these preventive techniques, we can and we will fight this scary
disease.
This scary
and it's going to be
infection.
over.
And it's
It's
going to go
pass.
away. And it's going to, right? And again, humans are resilient, and I'm sure we all will together fight this.
So see you
Take
guys
care.
next time, probably next week sometime.
Yeah.
And
Take
send us your questions.
Yeah.
Bye.
Take care. Bye-bye.